Hello guys, today's topic is myxoedema coma. This is a very serious condition and medical emergency. This is caused due to some trigger points in patients suffering from prolonged hypothyroidism. Prolonged hypothyroidism must be there, that hypothyroidism, that is low T3, T4 levels in blood must be there for prolonged period. And some trigger points are there. Trigger points, patient suffering from hypothyroidism for a long period when exposed to some factors that will lead to myxoedema coma. Number one, trigger point number one, exposure to cold. As patient is unable to cope with low temperature, they are cold intolerance, and when exposed to number one, cold exposure. Patient cannot tolerate cold and this may lead to myxoedema coma. Then number two, some type of stress, severe stress. They cannot withstand stress. Then infection. Infection due to any cause. This will also cause increased stress level. Then trauma, stroke, and myocardial infarction. These are trigger points. Number one, main is cold exposure, then stress, infection, trauma, stroke, myocardial infarction, and most common is, seventh is most common, that is forget to take medicine. Forget to take prescribed medicine. Patient is suffering from hypothyroidism, taking medicine for that condition, and he forget to take medicine due to any cause. He may be in journey or by work overload. All these things may cause myxoedema coma. Now coming to clinical features. Clinical features of hypothyroidism. Clinical features of myxoedema coma. In this case, number one, clinical features. Clinical features are, number one, this will cold, decrease temperature of the body. Decrease temperature of body. BMR is reduced, basic metabolic rate is reduced, then leading to, that is hypothermia. Decreased temperature of body, that is hypothermia. Then blood sugar is reduced. That is hypoglycemia. This is hypoglycemia. Blood pressure is reduced. Blood pressure is reduced. That is hypotension is there. Heart rate reduce, that is bradycardia. Bradycardia. Fifth, brain receives little amount or less amount of blood and so oxygen. Therefore, there is altered consciousness. Altered consciousness, and this may lead to coma. Decreased temperature, that is hypothermia, then blood sugar is reduced, causing hypoglycemia, blood pressure reduced, that is hypotension, heart rate reduced, bradycardia, and hyponatremia. Electrolytes are disturbed, hyponatremia. And this will lead to hyperventilation. Ventilation is more to provide adequate amount of ventilation, but later on this will reduce. Rate of respiration reduces, causing hypoventilation. Hypoventilation. These are the clinical features of myxoedema coma. Now coming to investigation. What are the investigations? Lab investigations may delay the treatment. It is a very serious condition. Investigation. First is clinical. There must be clinical observation may say that patient is suffering from myxoedema coma. Clinical observation and clinical decision. Number 2, thyroid function test. Thyroid function test to know the thyroid function test to know level of T3, T4, TSH, anti, that is TG antibody, TPO antibody. These things, then CT scan, MRI, and ultrasonography of thyroid gland. Third is arterial blood gas analysis. Blood gas analysis, electrolyte level, blood glucose estimation, and oxygen level. Oxygen level must be rapid by pulse oximeter. These are the findings, and CBC to exclude infection. These are the investigation. But patient is very serious, therefore patient must be transferred into ICU. Treatment protocol. Treatment is case of a patient of coma must be transferred into ICU as soon as possible. Then IV channel, IV fluid therapy. IV channel is maintained to give IV fluid to correct glucose level to correct glucose levels, electrolyte levels, to give antibiotics, if infection is suspected. ECG to know the condition of heart, oxygen therapy, and last but not the least is passive warming. Passive warming. Line of treatment is transfer patient to ICU, intensive care unit, then IV fluid. By IV channel, we give IV fluid to control glucose level, electrolyte levels, antibiotic, and other drugs in case of emergency. ECG is done, oxygen therapy, passive warming, and monitoring of patient is very essential. These are the to treat the patient. So in this video, we learned what is myxoedema coma. This is due to some trigger facts to prolonged hypothyroidism. Patient suffering from prolonged hypothyroidism is exposed to some trigger point, then he or she may suffer from myxoedema. Points are cold exposure, stress, infection, trauma, stroke, MI, myocardial infarction, and most important is forget to take prescribed medicine for hypothyroidism. Clinical features are reduced temperature of body, that is hypothermia, blood sugar will reduce, blood pressure reduce, hypotension, heart rate reduces, that is bradycardia. All these causes reduce blood supply to brain, leading to altered consciousness, and that may lead to coma. Hyponatremia, in earlier stage, ventilation is increased, but later on, ventilation will decrease, causing hypoventilation. Now, investigation, clinical is most important. Then, thyroid function tests are done, T3, T4, TSH level, anti-TG antibody, TPO antibody, CT scan, MRI, and ultrasounds are performed. Then arterial blood gas estimation, electrolyte level, blood glucose level, oxygen by pulse oximeter, oxygen and pulse rate, and CBC to exclude infection. Now coming to treatment portion, ICU, patient must be admitted to ICU as soon as possible. Then maintain a IV channel to give IV fluid, glucose level, electrolyte level, and antibiotics are given. ECG is done to know the position of heart, oxygen therapy, passive warming, and monitor the patient regularly. Thank you very much. Please like, share this video, comment on this video, and subscribe the channel. Thank you very much for watching.